We'll now look at glenohumeral or GH ADduction, so toward the midline. Again, just to orient, your midline are your spinous processes, so it would be muscles that pull the humerus toward the midline. This is a frontal plane motion. We're in the frontal plane, and it occurs about the anterior posterior axis. So let's look at this. We'll look at it from both the posterior and the anterior views. So we have the latissimus dorsi contributing to this motion, pulling into ADduction. If we talk about the latissimus dorsi, we also talk about the little lats or the teres major muscle. And then we're going to look at the anterior muscle that are responsible for this motion. And we see the pectoralis major, the sternal portion of the pectoralis major. And since the coracobrachialis inserts on the medial side of the humerus and the coracoid process is more medial, it also helps with ADduction. In summary, for glenohumeral or GH ADduction toward the midline, we have the latissimus dorsi muscle, the teres major, also known as the little lats, pectoralis major, the sternal head, and the coracobrachialis. And again, ADduction is a frontal plane motion about the anterior posterior axis.